I have a full, about 5 or 10 minutes? 10 minutes? Yeah, so thank you for that. And thankfully my topic is much simpler and probably easier because it's my goal to kind of convince you guys that policy is important to medical education and that a health policy internship would be something worth pursuing for many people. Not for everybody, but for many people. And just before I get going, I just wanted to say that these are the things, these Benjamin Rush meetings are the things that get me excited about medicine, and to be around so many amazing people doing so many cool things to talk to all of you. It's so inspiring, and I'm just so happy and actually humbled to be recognized among you as someone who's contributed. But I did want to share something that I hope many of you have experienced or will experience. And that's one of the best compliments I've received so far was from my dean of men, or dean of students. And I was with Eric, and we were preparing for our debate, and we were like in a fluster trying to get things going. And he was like, you're putting together a debate, and he's kind of aware of what we were doing. And he shook his head, and he's like, you guys, you're kind of troublemakers. I was like, yeah, we kind of are. But polite and quiet troublemakers. I feel like that's kind of the spirit of Benjamin Rush, to take a stand and to challenge people, but to do it gracefully and to learn with each other. So anyway, I hope many of you have that experience and are called troublemakers in the future. So let's see, where do I want to begin? I want to just start with just policy. So much of what I wanted to say was thankfully already said by many of the speakers. Which is good because it means that everything I was going to say is absolutely right. So you can trust what else I have to say. So that's just that policy, things are changing. We're being pressured as a profession and what we're doing, and so we have to adapt. And I think it is true that we can't just be doctors anymore. And when I talk to people that are asking me, like, what are you doing in medical school? And I'll explain a little bit, and I find myself end up saying, like, I don't want to just be a doctor, I want to do this. And then I'm thinking, that sounds so incredibly ungrateful for the position and the importance of being a doctor. We should be thankful if we can just be doctors. That's the highest thing that we could be doing. But we are being pressured. And so we do need to adapt, and I think that doing something that will give you multiple perspectives of how you can affect the industry is what we need to be doing. And so when people ask me, like younger people, and what I hope that you'll the advice that you'll give your younger members when they ask you, like, what do I do the year after my first year? There's so many different things you can do. And many people, if you know exactly what you want to do and you want to do surgery and you need to do that research and it's your plan, then go for it. That's great. But I would encourage you to not do research for research's sake. It was kind of scary for me to go do something in DC with the Heritage Foundation and not do something research-based like a lot of people. But at this point in our educations, you need to be doing what really excites you and pursuing your interests, whatever they might be. What I say is, research or resumes were made for man, not man for resumes. So don't worry about your resume. It'll pay off when you're excited about what you do. You'll be very good at it, and somebody will pay you to do it. Plus, at the end of the day, we're all going to be MDs, and we can practice medicine, which is just an incredible gift. So the internship in DC, it's just like a whole nother experience that you cannot experience that from your home or from your school. And I want to just jump right to there and then finish pretty quickly. And then if you have any questions about the more details about how to actually play it out, feel free to ask them. But yeah, I did the internship at Heritage Foundation, and I think there's three big things why you should do a health policy internship, especially with the Heritage Foundation. And that's basically, it's just an incredible educational experience. It's so enlightening. And it's also, it's paid, and not just in cash, in a number of different ways, but also it's just a ton of fun. With the education, I really want to emphasize, today, I thought the speakers, they're just getting better and better as the day goes on and as the conference goes on. And what I'm personally really interested in is learning how to think. I don't know how many of you guys are really, really loving the things that Dr. Haynes had to say, but I come to these things and I want to learn how to make complex situations and problems simple. And that's what people are looking for. They're looking for clarity. And so I really do think that we need to emphasize, how do we think about policy? How do we think about these big issues? What is a right? What is a human right? We need principles to work from so that we can think about any issue in the future and guide our patients. And that's another thing. With the policy, we're looking after our patients. It ultimately always comes back to taking care of your patients, your current ones, and everyone in the future as well. And I kind of think, I heard someone given the analogy, policy kind of seems detached and cold, and a certain type of creature would go out to DC to do policy. But really, it's the hardware, and we're all operating within the system, and we're bound by these limits. And policy is the hardware that sets the stage for you to express your creative genius and come up with solutions to how to provide better health care for your patients on an individual, customized level. So we really do need to care about policy, and we need to transmit that message. So enlightening, we need to learn how to think And the Heritage Foundation does an amazing job. They have this program called First Principles, where they go from the founding of the country all the way up to the present day, and they do it every week. It's Dr. Azarad who directs it. He's an amazing speaker if you know who he is. And we talk about everything. Basically the founding principles, we talk about where libertarians and conservatives split ways, what was the progressive movement, all those things. We learn how to think about it so that when new issues come up, you're not just caught on your heels, you kind of have an idea of where to start. Like, what principles are we working with? And then also, when you're trying to understand the people that disagree with you, you have to get to the principles that they're operating with. And if you understand their principles, then you won't be shocked by the conclusions that they come to. And you'll be a much more effective communicator and more persuasive. So these things are very practical, even though it seems maybe, up here in philosophy or something. These are what we need to be really training ourselves to do. And doing it regularly, because it's like anything else. It's, if you don't do it regularly, you're not going to be good at it. So don't be surprised if you don't have the best answers for people when they challenge you, if you've never practiced talking about it. And that's like coming straight back to me too, because I'm trying to answer questions for people, feeling like I have no knowledge base at all. But just like Dr. Edison was saying, you know more than you realize. You're not an expert for sure, neither am I, but you have something to offer, and that's what people are looking for. It's just a little bit of logical way of thinking about something, a little bit of clarity. So don't cut yourselves short. Take a chance, go engage in conversations. And then, so that's what Heritage and what Benjamin Rush does, is they prepare you for those conversations, learning how to think and talk. So that's just I found that to be so incredibly enlightening. Not to mention all the amazing speakers that Heritage is able to pull in, ambassadors, presidential candidates, senators, everybody. And you can go see any topic that you want. And to be honest, in the health policy department, there's a lot going on right before I got there, preparing for the Obamacare subsidies, which was going through the Supreme Court while I was there, which is something else that I'll talk about in just a second. But we didn't have a whole lot of work for me to do. So I went to Senate meetings and I summarized what they were talking about, brought it back to the department. But most of my time was spent going to hear speakers talk about everything from family issues to domestic economic problems to foreign policy stuff. And I just found it to be so I got a little taste of everything, and that's exactly what I was looking for. So I'm kind of like a jack of all trades, master of none, but that's what I was looking for, and that's really helpful to lay the foundation of how do we think. And I would recommend that for anybody. But as a department, I helped with a couple of small projects, but that was my personal experience, not having a role as more of a producer. I was just learning. I was a student. But most of you know by now that Danny McCory had a different position where he was more of a fellow, and he was able to write an amazing brief on a policy like direct primary care and actually have it be an actionable product that he made that someone used to make law. It's incredible. It's an incredible accomplishment, and that's what you can do when you're at a think tank like Heritage or AEI. I know they have interns as well. So these things are amazing opportunities to learn and to produce. And that's one way it pays you, is it prepares you for your future. It prepares you by allowing you to have connections and building these friendships, which they do last. I'm actually meeting up with some of my friends that I made last summer this evening. And people that are doing, just like you, they're doing amazing things, creating things, getting into business, tech, applying it to medicine or whatever areas. A lot of them are going to law school because they're doing the policy thing. But building friendships with people that study other things, that's another way that you can just expand your mind and learn how to think from different perspectives. That's exactly what we want to be doing. So, and finally, it's incredibly fun. And this is what I would just kind of finish with, is we can all learn these things from our home, but that's not the same as being in the middle of it. It's adding color to the sort of the framework that you're building. And so when I'm learning about health policy, and then I get to go to the Supreme Court steps and be there when they pass down the legislation that says that they're going to allow the subsidies to remain. And people are going crazy and they have their signs up, and then we're also holding our signs, and then we're kind of viewed as these crazy people, and we're definitely the minority, but it adds a sense of urgency and passion that is literally probably the biggest reason why I'm more excited about medicine now than I was a year or 2 years ago. There's this incredible energy that comes from it. So I encourage this for you or for any of your younger colleagues that aren't exactly sure what path they want to take, they have broad interest. Tell them to consider a health policy internship, come out to DC, see why these things are important, and then bring that energy back, get your student groups going, and continue doing what Benjamin Rush does. So that's what I'll leave you with.